Greetings, friends and followers. This is Nurses Talking. I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. So, here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I am very, very pleased to welcome for the second time Dr. Kenneth Odessa Lubigan. Dr. Lubigan is an author, he's a professor, he's a clinical instructor, a nurse esthetician, and a wound care nurse. So, welcome, welcome, welcome.
Yeah, thank you again, Miss Dale, for this opportunity to be with you tonight. Tonight here in the Philippines, in early in the morning there in your country. I
Yes,
am so
yes,
happy and pleased to be with you again.
yes. And yes, it's good to talk to you in the Philippines. So tell me, the last time we spoke, you were on a journey. You were heading towards a PhD, and so now
Mhm.
you have acquired that. Tell me what has happened in the time since we spoke. How has it
Yeah,
been?
a lot. Yeah, a lot actually happened before the time before today. Because when we first met, we have the first interview. I was still in the beginning of my journey with my PhD, and
Mm-hmm.
the time was the time of the pandemic when I
Yes.
was I decided to stay home and to do some private practice, attending clients in the home care settings with the guidance of many doctors here and abroad. And yeah, to cut the story short, I was able to do everything, though there are really challenging time during those years of finishing and doing the work and also attending to my relative who are also were also affected by the COVID. But I was able to finish it well. And right now, currently, I am working with my alumni school with my PhD in other school in Manila.
Awesome, awesome, awesome. And you seem to be doing a lot concurrently. Um I know that you work in different, for lack of a better word, for better, different provinces in the Philippines. So sometimes you're in Manila, sometimes you're in your hometown, and you work in both of those areas, huh?
Yes, most of the time right now I am in Manila. I work in two city, Quezon City and Pasig City. Sometimes most of the time I'm in Manila, and sometimes after working in the city in the Metro Manila, I work here in my province in Lipa and sometimes in Quezon. So because there are many clients that I attend to doing my home service procedures or intervention as a nurse.
So just to clarify for those who are watching, you most of what you do hands-on is private practice.
Yes, I am. I am.
Mm-hmm. And so as a wound care nurse and an esthetician, but you have a clinic, yes?
Yes, I do have a small clinic at home, but most of my client preferred me to go to their places for their comfort, and also some do not want them to be, disturbed when they are doing their own thing. And sometimes the clients have only nighttime to do the procedure, so I give them that kind of comfort for me to be able to go to their place and do the procedures, and then right after that they can really rest in the comfort of their home.
What kind of procedures do you offer?
I do sometimes remove warts and then also nursing procedure like I do insertion and removal of Foley catheter, NGT, and wound care. And that's all the procedures that I did. Sometimes I do also assist some doctors when they are doing procedure at home. For example, those client or patient that needed to be attended at home for some reason because of the age, because of the distance. So they sometimes call their doctors, and I am the one assisting the doctor in any procedures that they are doing at home.
Mm-hmm, mm-hmm. So I have so pretty much you're kind of like functioning as a concierge in the Philippines. Is this common practice?
Uh, right now, it began for me during the pandemic
Mm,
because even doctors here in the Philippines are attending clients at home. They're doing home service because that's very comfortable for the client. And also, many client or patient is very hesitant to go to the hospital because of the pandemic. So they are
Mm-hmm.
paying a lot more just for them to receive the care at home because they are more comfortable and they feel secure that they will not be affected by the COVID.
Yeah, yeah, yeah. So you still have, so do you at this point still have high incidence of COVID?
Well, right now the incidence is very low. Our country even declared the pandemic not the same as before, so we
Mm-hmm.
can actually work around. We are starting to go to the new
Yeah.
normal as they called it, and yeah, but still, there are a lot of clients who've been used to be cared at home. So that's why they are requesting that if I can go to their places, if the procedure is very minimal and can be done at home. But of course, there are really some that needed to be done in the hospital settings.
Mm-hmm.
So we do really encourage them to do it in the hospitals.
Mm-hmm.
So
Mm-hmm.
it's
I
much
get.
more or less compared to the previous years.
Yeah, yeah, I understand. I understand. So now, you also, or also an educator, and you've just completed a PhD. What have you learned along the way in your own education that you think um impacts yeah, impact probably is the word, your own educational, your own philosophy, the way you would like to educate others coming along?
Yeah, one of the I will say one thing that I realized after finishing my PhD is that everybody can teach in the schools, in the university, in the classroom setup, in the clinical setup. But what I realized that if I will be the one to teach the students to be part of an institution, I should have something unique to give them. Like for example, I am not going to repeat anything seen in the screen. I will not just mimic everything that I read in the book. I have to have an output from that so that it can begin or I can start with a new ideas. Because as a PhD graduate, as my friend told me, we have to be scholars. We have to have some what we call a development of a more
Mm-hmm.
clinical, of a more analysis of everything that we see and do in the hospital settings. So we should have an impact, not an ordinary teachers. We have to make a difference when we become part of an institution and we teach students.
Mhm, mhm, mhm. What would you say then? Given that, what would you say then is your big vision? Where do you see yourself in this whole big scheme of things of educating newer nurses coming around, like in the next 10 years or so? Because nursing is all about, well, not all about, but big parts of nursing, especially as an educator. Yes, you have the education, but you have innovation, and you've got to have a vision, particularly now that technology is such a big thing. Where do you see, how do you see things changing and evolving? And what would you like to see in the next 10 years or so?
Well, I hope because right now, actually, as part of and one of the active board of directors here in the PNA chapter in our province, the PNA National here in the Philippines, Philippine Nursing Association in the Philippines national level, already made their position paper regarding the what should I say because right now there are less nurses working in the Philippines in the clinical setup. So they are trying to show and identify the problem and make a solution. So for me, as I see myself 10 years from now, I believe I should have something to share to my students and to the nursing community. For example, I would like to have an additional theory that is Philippine based that will help the Filipino nurses see nursing in a more deeper manner because I'd like to know why are really many Filipino nurses working in abroad and why they are not working here in the Philippines. Also, so that the educators, the government here in the Philippines will see that kind of uh, of thing as a way to solve that kind of problem because in our settings here in the Philippines, many nurses are taking boards. A lot of them pass the board exam, but there are really how do I say this a big number of nurses that is needed in the hospital settings. So the reason the question is why. So we are not lacking in nurses, but there are really a lot of nurses who do not want to work in the hospital for some reason identified by our nursing association here in the Philippines. So I'd like to share in my own capacity, like for example, a theory that will be the basis of why and a way for them to really a like an evidence so that they will believe that is that's the reason why they have to do something about nurses in the Philippines.
So I'm gathering from what you're saying that officially or hierarchically, well, as far as government or administration or whatever is concerned, nurses are not really highly or as highly regarded as you would like them to be, and that perhaps that's one of the reasons that they're leaving. Does this show up in things like salaries, and respect or anything like that? Would you say?
Yes, also the benefits, the how common people see nurses as they work in the hospital, both in the private and the public hospital.
So let's move on a little bit to your book. You are the author of a new book. What is this book? What is it called and what is it about?
Yeah, actually, here in the Philippines, a very good actually he's one of my idol. His name is Dr. Emerson Aliswag. He was the founder of our organization that's called the Panacea.
Mm.
So we are a group of doctors or nurses with at least master's degree who develop or developing books dedicated for Filipino nurses. So the settings of the book is really for Filipino because most of the book that we are using are American based, Western. So he envisioned that also Filipino can make book for our own country. So I just one of those very lucky co-author of that book. So I was one of the co-author of the book in pharmacology, but though he had many books that he published here in the Philippines. So it's a
Mhm,
very good
mhm,
thing because right now I'm also in the process of publishing my own research during my PhD. But he was
mhm.
giving me the chance to be part of that very special task, no, to develop a book that will help the Filipino nurses because that book is Filipino based.
Yeah, yeah, and therefore, I would say more culturally appropriate.
Yes, that's correct. That's why he envisioned that because sometimes there are conflicts in the books that we use in the school and in the settings in the Philippines because, for example, the availability of the stocks, no, in medical surgical, the availability of the machines that the books is telling us that we
Talking
should
about.
use, because our country is not rich as USA
Mm-hmm.
in the Western country, so maybe he thought that one of the reason why we cannot really do our task is because we are basing it in a book with a standard that is not applicable here in the Philippines. So that's why he want to set the book based on the Philippine setup, which
Mm-hmm.
make it
Mm-hmm.
more appropriate for the student to understand it well.
Yes, yes. I can see that. I can see that. I understand that completely. Well, I think I have another question about
Mhm.
you um coming going from where you were when we last spoke to now. I know this you were doing a lot of this during the pandemic, but what has challenged you?
Well, actually a lot, both personal and professional. There are many challenges. Some are really, can really break or make me. But actually, I'd like to say that it make me a better person.
Mm-hmm.
In a professional level, I have to transfer from different school, you know, because I wanted to grow more.
Yeah.
And that's the reason why I took my PhD because I wanted to be someone who can advocate for something and to do something different and unique. for myself, for the nursing, for my student, and for the institutions. And I do not want to be on the specific of everything, but time is one of the challenge
Yeah.
because during pandemic it's very hard to really work at the same time and study, especially that this is a PhD. You know how is it how it was. It's not really same as our how do I say this um like in our colleges. It's different.
Mhm.
You really have to make time, the effort. You are talking to your coworkers, professional, even uh to your people ahead of you. I mean your bosses, so your
Mhm.
superiors, before you can finish everything. And also transferring from my here in Lipa City, Batangas, in Quezon, San Antonio, Quezon, and to Manila, it's really a challenging one. And when your relative is the one who was sick during the time, my mother, my mother-in-law, my wife, my brother and sisters, I was almost about to give up doing my PhD because I really have to make time because during the pandemic time is really out of essence
Yeah.
and you really have to be fast. And if not, life would be the one that will be lost. So those were the things. And also right now, actually, I just realized I am already married, right? I've told you before, and right now we don't have yet a child, and I just realized just this year why we are not really focusing on having that one because I was so busy doing my professional growth and
Yeah.
probably many things around that keep me unfocused with that, which
Yeah.
is why
Yeah.
right now we are on that road because we are not getting any younger anymore. And maybe one of another challenges was also the distance, but I have to sacrifice it
Mhm.
because staying in a place where growth is not really that possible will
Yeah.
make you really stagnant. So I don't want that
Yes.
to happen to me because I've said time is running. So I really have to transfer from one school to another to see myself as a person who makes a growth not only for myself but also for the community where I will be working with. And that's
Mhm.
what my
Mhm.
goal. And I will not stop until I finish because again, I don't want to be, I don't want to be stagnant to a place and to group of people where growth is not possible or there are a lot of hindrances that can make me not to pursue my goal in life.
Gotcha. 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 So I have a question now. You have done and you are doing quite a bit, a lot, in fact, currently. What do you do to take care of you?
Well, one of the thing is I am now having my because I'm already above 30s. So I'm having now my medical checkup to check if my body can still work the same as before that when we first met. Also, we're doing our workups with my wife, so that we will know how to prepare our body with the childbearing process. And I do take my vitamins. I do have exercise. I make sure that even though I work from normally from 6 a.m. in the morning up to 10 p.m. in the evening, I have to have a rest in between
Mhm.
so that my
Mhm.
body can functions. I have to do that power nap so that my brain can function well because sometimes I do double shift just to compensate for my distance sacrifice from
Yeah.
here and in Manila.
Yeah. Yeah.
And of
I
course,
I
I choose to be happy most of the time. As you, one of the thing also that I realized after finishing the PhD, it really doesn't matter if you have a great uh, number of people around you. What important is that you have a good people around you that supports you, that give you positive feedback. Though it might be a criticism, but you have to look on the good side of it. And you should look at everything that happens to your life as a process. It's not a how do I say this, a well, a challenge, the process for you to grow. You always see the good things in everything that happens to you, even if other people might think it's a problem, because when you see things that way, you become more encouraged and you become more optimistic that, yeah, it's a process and tomorrow is another day and it might be solved.
And you're more likely to seek the tools to deal with whatever the challenge is. But I like the fact that you use the word you choose to be happy because it can be it's a choice.
Yeah, actually, you really have to, because along the way, in the schools, in your personal life, spiritual life, or you have many organization, many things happens, and if you would choose to make it affects you in a negative way, then it should be there. But if you choose
Yeah.
to see it as a way for you to probably develop yourself more, probably a way for you to adjust to the changes that is very inevitable because everything is dynamic. You have to accept
Yes.
things. Also, when I finish my PhD, you have to act differently because you have that kind of don't have you don't have to look it as a privilege, but you have to act something like you're a PhD. I mean, sometimes you choose not to smile most of the time when you are in the professional gatherings because it
Mm.
will have an impact on you, and you have to maintain the standards of being a PhD graduate also.
Mm-hmm. Yeah,
That is
indeed.
why Yeah, that's why I was so happy when Dr. Aliswag invited me to be part of that organization. Because
Yeah.
before it was my dream, I just saw people, the name of my favorite school teachers during my nursing careers who was written there in the book. And right now I have one with my name in there. And though I'm just a co-author, but it makes you proud and not all have that kind of opportunity, and I'm really happy I got that one thing.
Yes. Yes. Absolutely. Absolutely. And congratulations on that. Congratulations on that. Glenn, it's been great talking to you again. Any last words you'd like to leave us with?
Well, maybe I'd like to say that nursing is a really a dynamic process, starting from the very start when you are on your first year. And one of the theory that I always use with my students is the theory of Patricia Benner, which is also the novice to expert one. So as you grow, as you take years of nursing in your nursing career, you don't have to stay at the very low. I mean, even when you are still in your bachelor's degree, you have to be always expert, at least proficient to every task because in nursing there are a lot of procedures, a lot. I mean, very diverse. Nursing is very diverse.
Right.
You may be working at the hospital, you may be working as a manager in management, and you have to be expert because that is the only way that will help you make an impact to the people that you work with and to the patient that you take care with. Because with being an expert, it means you give yourself and you always try to see things at the most possible way it can help you and your client and even your students.
Yeah. Yeah.
and
Yeah.
and just to add one more theory, because now I'm in love with the theories also with the Madeline Lininger, the transcultural nursing theory, because along the way, just like you and me right now, in nursing career, you will be working with different people, with different cultures and beliefs. So you have to be sensitive. You have to use the appropriate manner, how to say things, how to do things. Even the nonverbal action that you do with your client is very important because you will really touch many people and they are very unique and different. And the way you do things will affect also the way they appreciate your care for them.
Yeah. 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 And you said something very profound there is that you said you will touch many different people. And I think we need to understand that that's a huge privilege. Not everyone gets that. Not everyone gets to do that.
Yeah, because I might too. I really don't believe that I will be nurse someday. I thought I'm going to be a priest or probably a policeman or a teacher because in our town in San Antonio, Quezon, those are the profession that you can see. I mean, every day.
Yes.
But right now, I'm really also happy because I was able to finish my PhD, and I'm really proud of myself and for all the people who helped me in one way or another. Many people also. And
Yes.
for the people just like Dr. Emerson, just like you, my advisor, and also my favorite dean, Dean Linel Malimbag, who've been my inspiration to really do more. Do not stop because you will have limitations if you put limitation on yourself.
On
But if you
yourself.
want to really grow more, you have the sky to live everything.
Kenneth, thank you so, so very much. It's been good talking to you again.
I am thankful for this opportunity because, like what I've told you before, it helped me also to be inspired to
Hmm.
grow. And actually, that I've told you that one of my school really appreciated this kind of what should I say, achievement that I had to be interviewed by
Hmm.
a person like you, and it helped me to rank my professional growth in that school.
It is gratifying to know that, that was a help to you. Thank you so much for letting us know that.
Yeah, thank you too, Miss Dale.
Alrighty, take care, Kenneth.